Wellness for Life is brought to you by Sanford Health Clinic and Same-Day Surgery Center, Purim Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, my name is Jane Leno, and I'm an occupational therapist at Sanford Health Detroit Lakes. During the month of April, we celebrate both National Occupational Therapy Month and National Parkinson's Disease Awareness Month. So I'm excited to be here today to tell you about a therapy program specifically for patients with Parkinson's disease called LSVT Big. As some of you may already know, Parkinson's disease is a progressive neurological disease. There are many different symptoms, but some of those include a shuffling, tiny gait, a tremor. Some people have difficulty starting or initiating movement, or maybe difficulty stopping once they've got started moving. Slow movements and small movements. LSVT Big focuses on one aspect of our Parkinson's symptoms, and that is moving small by helping people to move bigger, hence LSVT Big. What we found, however, though, is even though we're focusing on one aspect, moving bigger, people who finish the LSVT Big program notice an improved ability to move overall better during their daily living tasks, and have improved balance and improved coordination. LSVT stands for Lee Silverman Voice Training. There are two LSVT programs available, LSVT Loud and LSVT Big. LSVT Loud is a program specific for speech deficits with Parkinson's, whereas the Big program helps with movement problems. Both programs are research-based and evidence-based programs. An LSVT program consists of 4 sessions of therapy 4 times a week, so a total of 16 sessions over a month, each one lasting 45 to 60 minutes. It's intensive and a lot of work. The patient is asked to complete daily exercises at home, once a day when they are in therapy, and twice a day on days when they don't come to therapy. And you'll also be assigned daily carryover or homework assignments to practice those big movements at home. The treatment is tailored to each individual's needs and goals. Examples of some goals may be wanting to be able to keep up with your friends when you're walking outside, putting on a coat or a jacket easier, reaching down and picking things up from the floor, maybe improving your handwriting, being able to move easier in the grocery store, or just keep going with your hobbies and interests. A typical session of LSVT Big begins with our 7 maximal daily exercises. These exercises are designed specifically for the program to help us maximize our effort and maximize our amplitude or size of movement. They incorporate a lot of trunk rotation and balance, stepping and reaching, and each can be modified to meet the individual's needs. The second half of the session, we focus on incorporating our big movements during daily living activities. Walking, getting out of bed, getting up out of a chair, dressing, reaching, writing, all of those goals we talked about earlier. The eventual goal of LSVT Big is for the person to learn normal movement size and normal movement patterns. So you may be wondering, why can't someone with Parkinson's disease just move bigger anyway if that's what they need to do? Part of the problem is a sensory disconnect. It might feel to them like they're moving normally, although they're not. So an important part of the program is to help people with Parkinson's disease recalibrate or start to realize how it feels to move normal again. Research has shown us that the best time to get started with LSVT Big is soon after receiving the diagnosis. It gives you the greatest chance of making a difference at the brain level. However, I can tell you in the 3 years I've been doing this program, I've worked with over 40 people, and all at various stages of the disease and various ages. And all of them leave the program moving better and feeling better, moving easier. LSVT Big really empowers people with Parkinson's disease to make a positive change. Our assessment process will help determine if you are appropriate or someone that you know is appropriate for the LSVT treatment approach. After completing the Big program, we need you graduates to complete the exercise program every day and keep moving big. So to help with this, Sanford has collaborated with the DLCCC to provide a weekly exercise class for graduates of an LSVT Big program. The class will be held at the DLCC every Wednesday at 10:30 in the morning. If you're interested in the LSVT Big Treatment program, either for yourself or someone that you know, I would strongly encourage you to talk to your primary care physician or your neurologist and ask for a referral to a certified LSVT Big clinician. If you want more information about either LSVT Loud or LSVT Big, you can go to the LSVT Global website, www.lsvtglobal.com. Detroit Lakes is very lucky in having a wonderful support group for persons with Parkinson's disease and their caregivers or spouses too. They meet on the last Thursday of every month at 2 o'clock at the Ecumen Nursing Home. If you want more information about the Parkinson's Disease Support Group, talk to Sue Sorensen on 218-846-7118. I really hope this information about LSVT Big has been interesting and helpful for you. It is possible to take control of Parkinson's disease, and LSVT Big is one way to help.
Thank you for watching Wellness for Life, brought to you by Sanford Health Clinic and Same Day Surgery Center, Parham Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,